You basically think of the neck as an onion. So, like you peel off the layers of the onion, you think of the layers of the neck as an onion, and instead of one sheet of fascia, you imagine multiple layers wrapping around different structures. Now, first and foremost, we have the skin, right? So, the skin is basically the most superficial part. It goes around the entire neck like this, right? And then we move on to the next layer, which is your superficial fascia, right? So right inside the skin, you have the superficial fascia. So if I imagine the skin like this, okay. So right inside the skin here, you will have your superficial fascia. This is going all around the neck, right underneath the skin. And then we have the investing fascia, which is basically the deep cervical fascia. So all of this green line you can see is basically the investing layer, right? So the investing layer is basically the first layer of your deep cervical fascia. This goes all around the neck, right inside your superficial fascia. So it was the most outside was the skin, and then there was the superficial fascia, and then we have the deep cervical fascia's investing layer, right? Now the deep cervical fascia also has three further layers. So right inside this investing layer, you also have something called as the pretracheal layer, right? So where is the pretracheal layer? Can you see this pretracheal layer? So this is the pretracheal layer. Okay. So this is your pretracheal layer. And you can see this is basically your C-shaped cartilage rings of trachea. So right in front of your trachea, you have this pretracheal layer, right? And now can you see these pretracheal layers extensions that on both lateral sides carry this carotid sheath? So on both lateral sides, you have this carotid sheath. And inside the carotid sheath, you basically have the carotid artery on this side and the carotid artery also on this side, right? The carotid artery also has something else, which is basically your internal jugular vein. So this blue structure here, can you see this blue structure inside the carotid artery? This is your internal jugular vein, and this is your internal jugular vein. And this black structure inside is basically your vagus nerve. The vagus nerve lies inside the carotid sheath, and these roots of ansa cervicalis are basically just on the anterior sides of the carotid sheath, right? And the sympathetic trunk, if I show you properly, if I remove these big ugly red things I've made. If I show you properly here, can you see the sympathetic trunk over here and the sympathetic trunk over here, right? Okay, moving on. So the superficial cervical, there's a superficial cervical fascia, which is just beneath the skin, and coming outside, right? So I said there's the skin. So this is basically my skin, and right underneath the skin, this layer is basically my superficial cervical fascia, right? Now this superficial cervical fascia, what does it have? This superficial cervical fascia has fat, it has superficial veins like external and anterior jugular vein, it has some cutaneous nerves, and it also has the platysma muscle. So let me go and show you the platysma muscle. This is the platysma muscle, right? So this is all of this is the superficial cervical fascia. This is the platysma muscle, and this is your external jugular vein. So this is basically your superficial cervical fascia. Only platysma muscle lives here, right? And now the deep cervical fascia, I told you, has three layers. Also the carotid sheath. If I add the carotid sheath, it's a total of four layers. The investing layer wraps everything. Going back to our picture here, this investing layer basically wraps everything. This investing layer, can you see this green outside investing layer? This layer basically wraps everything. This is the investing layer, right? It wraps everything. It surrounds the entire neck like a collar. It splits to enclose your sternocleidomastoid and trapezius. So let me show you that. Can you see that it splits here to surround this sternocleidomastoid, this trapezius, and this trapezius. So this investing layer basically splits to surround these sternocleidomastoids and trapezius. So much roughness, dirtiness I've created here. Let me go back, right? Let me go back and clean this up for you guys. Okay. So if I talk to you about the investing layer, where is the investing layer attached, right? It's attached to the superiorly, it's attached to the mandible and mastoid process and the superior knuckle line. And inferiorly, it's attached to the clavicle, the sternum, the acromion, and spine of the scapula. Let me see if I can show it to you here. So this is the investing layer of the deep cervical fascia, right? This is your deep cervical fascia. It goes all the way from the mandible. Here they're showing you the ligamentum knuckle. So posteriorly here you have the superior knuckle line, and inferiorly this goes on to to the acromion process of the scapula. Right here, you cannot see it laterally. If there's a picture laterally, I can show it to you. Okay, never mind. Okay. So you can just imagine that superiorly it's attached to mandible, mastoid process, superior knuckle line. Inferiorly it's attached to clavicle, sternum, acromion, and spinal scapula. Because it encloses the parotid gland. Okay. So since this investing layer encloses your parotid gland, what happens is swelling during mumps, which is basically inflammation of the parotid gland, is very painful. The tough fascia does not stretch much. So because of that, the parotid gland inflammation, which is basically the mumps, is very painful. Okay, moving on to the pretracheal layer. I showed you the pretracheal layer. Here, the pretracheal layer wraps structures involved in breathing and swallowing, right? It contains the muscular part. The muscular part encloses the infrahyoid muscles. All the muscles below the hyoid bone, it encloses, and the visceral part encloses the thyroid gland, trachea, and esophagus. So this pretracheal layer has two further parts, right? It has a muscular part which encloses the infrahyoid muscles, all the muscles underneath the hyoid bone, and it has a visceral part that encloses the thyroid gland, the trachea, and the esophagus, right? Important extension is that inferiorly it blends with the fibrous pericardium. I can show that to you here. So basically, can you see that this is your pretracheal fascia? So this pretracheal fascia is right in the front of the trachea and it closes off the thyroid gland and goes off to get continued as the fibrous pericardium. It blends with the fibrous pericardium here, right? So a neck infection can travel through this facial plane right inside the superior mediastinum, right? Okay. Then we have the prevertebral layer, right? Now the prevertebral layer by its name is around the vertebra. The prevertebral layer surrounds the vertebral column, the deep neck muscles, the scalene muscles, and the prevertebral muscles. So can you see this is your prevertebral layer? Right? It's enclosing all these deep muscles. It's enclosing the scalene muscles. Here you can see the scalene anterior, the scalene medius, the levator scapulae, the splenius capitis here. This is the vertebra. This is all of this is your vertebra, right? So this is all your vertebra. So all of this basically, what does the pre-vertebral layer do? It encloses your vertebral column, your deep neck muscles, your scalene muscles, and the pre-vertebral muscles. Now laterally, can you see that the lateral extensions are going off and they are forming the axillary sheath, right? Now laterally, you can see these extensions also going into the carotid sheath, but laterally here. Laterally, all of this fascia will go and spread into the axillary sheath. Now, when it spreads into the axillary sheath, it encloses the brachial plexus and axillary artery. And so this laterally here and here. This basically goes into the axillary sheath and basically in the arm, right? So your both arms, right? So it encloses the brachial plexus and the axillary artery and it continues into the axilla. So an infection beneath this layer, under this layer, may spread to the posterior mediastinum, right? Now let's go and look at our clean image above. Can you see this is your prevertebral fascia? So all of this is your prevertebral fascia. And now obviously this will go into the posterior mediastinum, right? So this is posterior mediastinum. Here, this pretracheal is going into the superior mediastinum, right? So this is the difference you should know in the infection traveling. Then we have a carotid sheath. Now, as you can see in this image, the carotid sheath is not a separate sheath. It forms by contributions from the investing. Here it's coming from the investing layer. Here it's coming from the which layer? Pretracheal layer. And here it's coming from the prevertebral layer. So all of these extensions make up your this little carotid sheath. I will show it to you in a minute. This is your carotid sheath, right? This is your carotid sheath, which is coming from the pretracheal, prevertebral, and investing layer sheaths, right? Now it surrounds the next major neurovascular bundle. If I go from lateral to medial, most laterally you have this internal jugular vein, right? And then we have the common carotid artery, or sometimes the internal carotid artery. And right in the middle behind this dot is basically your vagus nerve. It also contains, by the way, it also contains some deep cervical lymph nodes. Some deep cervical lymph nodes. Yes, sir. It also contains some deep cervical lymph nodes. I know for some reason it's not doing undo. I don't know what's wrong with it. Okay, finally done. Some deep cervical lymph nodes are also present here, and here you can see the carotid sympathetic plexus is very close. The sympathetic chain is just outside, posteriorly present on the carotid sheath. I'll show you the carotid sheath here also. There's a very good picture here. Here, can you see this here? So this is the carotid sheath, right? And this is the common carotid artery. This is the internal jugular vein. This is the vagus nerve, and the ansa cervicalis is the roots of the ansa cervicalis are just anterior to it, and the sympathetic chain is just posterior to it, right, right anterior to the prevertebral fascia. Right, but the sympathetic chain is outside the prevertebral fascia. You can see that, right? So this is your carotid artery. This is your vagus nerve, which is right in the middle and behind the internal jugular vein and the extra carotid artery. Right. So this is also the carotid sheath. Can you see that above? You can see that there is the cranial nerve 9, 10, and 12. So there's the glossopharyngeal nerve, there's the vagus nerve, and the hypoglossal nerve. But in the carotid sheath, only the vagus nerve is present, right? Only the vagus nerve is present right in the middle of the carotid artery and the internal jugular vein, right? There are some facial spaces that are very important. Now, these spaces basically allow infection to spread. So if I take you back to this picture, what you can see and in this picture is that there is these basically from the pharynx from anywhere near the pharynx here, the infection can spread to the upper mediastinum here, right? And then there was this danger space we called infection spreading directly from the base of the skull to the diaphragm. So any base of the skull here can spread here to the posterior mediastinum and then to the diaphragm. This is called the danger space, right? And then there's also a pretracheal space. The pretracheal space, as I told you here, this pretracheal space, this can go into the superior or anterior mediastinum because the pretracheal fascia is continuous with the fibrous pericardium, right? Okay, that's enough for the cervical fascia.